You wake up at 2 in the morning. Again. Third time this week. You shuffle to the bathroom, stand there, and wait. And wait. The stream finally starts, but it's weak. Hesitant. Nothing like it used to be. You tell yourself it's just age. Everyone deals with this, right? But here's what most men don't realize until it's too late. That hesitation, that delay before urination begins, isn't just an inconvenience. It's your prostate sending you a message. And ignoring it could mean the difference between a manageable condition and a medical crisis. I'm Dr. Marcus Sullivan, and for over 12 years I've been translating complex medical research into information men can actually use. Today we're talking about the one warning sign that gets dismissed more than any other. The silent alarm that too many men sleep through until their options become limited. If this resonates, hit that subscribe button. What I'm about to share next changes everything. Let's start with what's actually happening inside your body. Your prostate sits directly beneath your bladder, wrapped around your urethra like a donut around a straw. In your 20s and 30s, it's about the size of a walnut. Compact. Out of the way. But after 50, something shifts. The prostate begins to grow. Not rapidly. Not dramatically. Just steadily year after year. This growth is called benign prostatic hyperplasia, and it happens to virtually every man who lives long enough. The prostate tissue expands inward, gradually narrowing that urethral channel. Think of it like a garden hose. When the hose is wide open, water flows freely. Strong stream. Quick relief. But if something starts squeezing that hose from the outside, the water slows. It takes longer to start. Longer to finish. The pressure drops. That's exactly what's happening when you experience urinary hesitation. Your bladder muscle contracts trying to push urine through. But the narrowed urethra resists. The bladder has to work harder. Squeeze longer. And that delay you feel, that moment of standing there waiting for flow to begin, that's the mismatch between bladder pressure and urethral resistance. Here's where it gets serious. Most men interpret this as normal aging. They don't mention it to their doctor. They don't track when it started or how it's progressing. They just accept it. But that acceptance is dangerous. Because while benign prostatic hyperplasia is common, it's not the only condition that causes hesitation. Prostate inflammation can do it. Prostate cancer can do it. Urethral stricture can do it. And the longer you wait to investigate, the harder it becomes to distinguish between them. The bladder itself starts to change. When it has to work harder every single time you urinate, the muscle wall thickens. It becomes less elastic, less efficient. Eventually it can't fully empty anymore. You finish urinating, but there's still urine left inside. That residual urine becomes a breeding ground for infection. It increases pressure on the kidneys. It creates a cascade of complications that could have been prevented. Now let's talk about the 3 biggest mistakes men make when they notice urinary hesitation. Mistake number 1. Assuming it's just getting older. Yes, prostate growth is age-related. But hesitation that worsens over weeks or months isn't something to normalize. It's something to document. Track when it happens. How long the delay lasts. Whether it's worse at night or after certain foods. That information is diagnostic gold, and most men never collect it. Mistake number 2. Self-medicating with less fluid. I've heard this dozens of times. Men start drinking less water, especially in the evening, hoping it'll reduce nighttime bathroom trips. But dehydration makes urine more concentrated, more irritating to the bladder lining, more likely to trigger inflammation. You're not solving the problem. You're adding another layer of stress to an already compromised system. Mistake number 3. Waiting for pain before seeking help. Urinary hesitation in early stages doesn't hurt. It's just inconvenient, annoying, easy to ignore. But by the time pain arrives, you're often dealing with acute urinary retention, infection, or bladder damage that could have been avoided with earlier intervention. The medical establishment wants you on medication the moment you mention these symptoms. Alpha blockers to relax the prostate. 5-alpha reductase inhibitors to shrink it. And yes, those medications work for many men. But they come with side effects. Sexual dysfunction, dizziness, fatigue. And they don't address the underlying factors that accelerated prostate growth in the first place. Link in description breaks down the complete prostate support protocol. Check it out after this video. So what makes prostate growth worse? What are you doing right now that's feeding this process without realizing it? First, chronic inflammation from processed seed oils. Soybean oil, corn oil, canola oil. These oils are in nearly every packaged food, every restaurant meal, every convenient option. They promote systemic inflammation, and your prostate is particularly vulnerable. Inflamed prostate tissue swells. It compounds the mechanical obstruction you're already dealing with. Second, high insulin from constant carbohydrate intake. Insulin is a growth signal. When insulin stays elevated throughout the day from frequent meals and snacks heavy in refined carbohydrates, it drives cellular proliferation, including in prostate tissue. The more insulin, the more growth stimulus. The more growth, the more obstruction. Third, sitting for extended periods without movement. Prolonged sitting increases pelvic congestion. Blood flow to the prostate becomes sluggish. Waste products accumulate. Inflammatory mediators linger. The tissue becomes edematous, swollen, and that swelling makes the narrowing worse. Those are the accelerators. Now let's talk about what actually supports prostate health and urinary function. Start with zinc. Prostate tissue has the highest zinc concentration of any organ in the body. Zinc regulates prostate cell growth. It modulates inflammation. It supports healthy hormone metabolism. But most men over 50 are zinc deficient. Absorption decreases with age. Dietary intake drops. And that deficiency creates a permissive environment for unchecked growth. Food sources matter. Oysters are the most concentrated source. Grass-fed beef. Pumpkin seeds. But if dietary intake has been low for years, supplementation may be necessary to restore tissue levels. 15 to 30 milligrams daily of a well-absorbed form like zinc picolinate can make a measurable difference. Next, saw palmetto extract. This is one of the few herbal interventions with actual clinical support. Saw palmetto inhibits the enzyme that converts testosterone to dihydrotestosterone, the more potent androgen that drives prostate growth. It also has anti-inflammatory properties specific to prostate tissue. Standardized extracts at 300 to 320 milligrams daily have shown benefit in multiple trials. Then there's lycopene. This carotenoid from tomatoes, especially cooked tomatoes, concentrates in prostate tissue and provides antioxidant protection. It reduces oxidative stress that contributes to abnormal cell proliferation. 10 milligrams daily from tomato paste or supplementation has been associated with healthier prostate markers. Magnesium is underrated here. It relaxes smooth muscle throughout the urinary tract. Better magnesium status means less spasm, less resistance, easier flow. 300 to 400 milligrams of magnesium glycinate before bed supports both muscle relaxation and sleep quality, which itself is disrupted by frequent nighttime urination. And finally, pelvic floor awareness. Most men have no idea they're chronically tensing their pelvic floor muscles. That tension restricts blood flow, impairs drainage, and makes urination more effortful. Learning to consciously relax that area, especially during urination, can improve flow immediately. It's not a cure, but it's a free intervention that compounds with everything else. Here's what this looks like in practice. You notice hesitation. You don't dismiss it. You start documenting when it happens and what might be triggering it. You eliminate inflammatory seed oils. You moderate carbohydrate intake to control insulin. You add zinc, saw palmetto, lycopene, and magnesium. You move regularly throughout the day to prevent pelvic congestion. And you practice pelvic floor relaxation. Within weeks, many men notice improvement. Faster flow initiation. Stronger stream. Fewer nighttime trips. Not because the prostate suddenly shrank to its youthful size, but because you've reduced inflammation, improved tissue health, and optimized the mechanics of urination. Does this replace medical evaluation? Absolutely not. If you're experiencing hesitation, especially if it's worsening, you need a baseline prostate exam and PSA test. You need to rule out cancer, infection, and other serious conditions. But once those are addressed, these interventions give you agency. They let you support your prostate instead of just managing symptoms with medication. Drop a comment if you've experienced this. Your story might help another man watching right now. The silent warning isn't silent anymore. You're hearing it. The question is whether you'll act on it before your options narrow. Urinary hesitation is your prostate's early alarm system. Respect it, investigate it, and support the tissue before it progresses to something far more complicated. This is about quality of life. About sleeping through the night. About standing at a urinal with confidence instead of anxiety. About maintaining function and independence as you age. Next video we're diving into the PSA controversy. Why your number might be elevated even without cancer, and what actually matters when interpreting those results. You won't want to miss it.